Hi, how are you?
Good, how are you?
Good, thank you. My name is Suad. I'm going to be your nurse. Can you start off by telling me your name and your birthday?
Adib Al-Qadr, June 12, 96.
All right, very good. And what do you prefer to be called?
Adib.
All right, very good. And what are your pronoun preferences?
He, him.
All right, thank you. So today we're going to be doing the full head to toe exam. So there's going to be a lot of stuff going on, lots of lights in your eyes. I'm going to be touching your neck. I'm going to have to be lifting your shirt for some parts of the exam. Are you comfortable with that?
Yes.
Okay, very good. Just let me know if at any point of the exam you feel any discomfort or if you would like me to stop for any reason. All right, so starting off just by looking at your general appearance, I can tell that you look well, you're well kept, well nourished, well groomed, you look calm, everything is appropriate, skin color is appropriate for ethnicity. I don't see any abnormalities or any deformities. Posture looks good. Everything looks good so far. So first thing we're going to start with is we're going to test all of your cranial nerves. So starting with cranial nerve number 2, I have this eye chart that I'm going to show you from a little bit afar. I'm going to have you cup one hand over your eye and read these letters.
L, T, F, P, H.
Perfect.
L, T, F, P, H.
All right, perfect. And then I'm just going to wiggle my fingers into your peripheral vision. Just let me know when you see them.
Yes. 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 Yes.
Perfect. Next, we're going to do cranial nerves 3, 4, and 6. So I'm going to move my finger. Just follow my finger with your eyes only. All right, very good. That's intact as well. Next, we'll do your trigeminal nerve. So I'm going to have you close your eyes. I'm going to be touching either side of your face. Let me know which side you feel me touching.
Left. Left. Right. Left. Right.
Okay, perfect. That's intact. Next, we'll test your facial nerve. If you could smile. Okay, smile is symmetrical. Close your eyes really, really tight. Don't let me open them. Perfect. And then puff out your cheeks. Don't let me push them. Perfect. That's intact. Next, you're going to test cranial nerve number 8. So we're going to do something called the whisper test. So I'm going to have you cup one hand over your ear, and I'm going to whisper something into your other ear. Let me know what you hear.
27. 36.
Perfect. That's intact. Now cranial nerves numbers 9 and 10. If you could open your mouth and say ah. Perfect. And then if you could swallow. Any difficulty or painful swallowing?
No.
Perfect. That's intact. And then cranial nerve number 12, if you could stick out your tongue, move it side to side. Perfect. That's intact. And then lastly, cranial nerve number 11, if you could shrug your shoulders. Perfect. And then move your head to the side. Don't let me push it. Perfect. Other side. Perfect. Forward and backward. Perfect. All of those nerves seem to be intact, so that's good. Next, I'm just going to take a look at your head. Okay, I see hair pattern is dispersed evenly throughout. I don't see any dryness, no signs of lice, and no masses, bumps, lumps, or lesions or anything like that, so that's good. And then looking at your face, I can see your face is symmetrical. Eyebrows and eyelashes are dispersed evenly. I don't see any signs of facial drooping. I don't see any abnormalities, and nose and mouth are midline, so that's good. I'm just going to palpate your frontal and maxillary sinuses. Any tenderness?
No.
Perfect. And then I'm going to palpate your lacrimal apparatus. Any tenderness there?
No.
Perfect. And then your temporomandibular joint, if you could open your mouth and move your jaw side to side. Perfect. All of those seem to be intact. All right, next I'm just going to look at your eyes. If you could look up, I'm going to pull down on your eyelids. Okay, sclera is white, iris is brown, conjunctiva is pink and moist. I don't see any signs of inflammation, so that's good. Next, I'm just going to check your accommodation. So focus on this pen light here. Now focus on something behind me. Perfect. Pupils accommodate well. next I'm going to shine this light into your eye just to check your pupillary reflexes. So just continue looking straight ahead. Right, perfect. Pupils are equal, round, and reactive to light, about a size 3. Now I'm going to check your corneal light reflex, so I'm just going to have you continue looking straight, and I'm going to shine this light in the middle of your face. All right, perfect. That reflex is intact. Very good. So next we're going to do the fundoscopic exam. So what we're going to do is we're going to turn the lights down really low, and then I'm going to be shining a really bright light, getting really close into your face just to look into your eye, okay?
Okay.
All right, just let me know if you feel any discomfort at any point.
Okay.
Okay, I see the red reflex. I'm going to place my hand on your forehead so I don't hit you. Come in really close. All right, I see the optic disc and the blood vessels and arteries. I don't see any hemorrhaging or exudate. All right, other eye. I see the red reflex. I'm going to come in really, really close. Okay, I see the optic disc and the blood vessels and arteries. I don't see any signs of hemorrhaging or exudate in that eye as well. So that's good. I'm going to go ahead and turn the lights on. Next we'll move on to your ears. So just looking at your ears, I can see that they are symmetrical. Pinna and tragus are symmetrical. I don't see any lesions or anything on the outside. I'm just gonna feel. Any tenderness?
No.
Perfect. Now I'm just gonna look inside your ear canals. All right, tympanic membrane is a pearly gray. Inner ear is pink. I see the cone of light and the bony landmarks. I don't see any redness or inflammation or any drainage, so that's good. All right, again, tympanic membrane is a pearly gray. Inner ear is pink. I see the cone of light and the bony landmarks, and I don't see any signs of redness or swelling or any drainage as well, so that's good. Next, looking at your nose, I see that it's midline. We're going to check the patency of your nostrils, so just block one nostril and blow out. Perfect, nostrils are patent. Now I'm just going to look inside. All right, perfect. Turbinates are pink and moist. I don't see any signs of bleeding or any signs of septal deviation. So that's very good. Next, I see your lips are pink and moist. You could open up. I see the buccal mucosa is pink and moist. Tongue is pink and moist. Hard palate and soft palate are pink and moist. I don't see any lesions anywhere. And then posterior pharynx, I see the uvula. I don't see any redness or swelling or any drainage or exudate. So that's good. And teeth look good. No signs of cavities or tooth decay. So very good. Next, I'm going to look at your neck. So we're going to do some range of motion first. If you could turn your head side to side and then up and down. Very good. I'm just going to take a look. All right. Trachea is midline. And then with swallowing, I see the rise and fall of the thyroid gland, and I don't see any signs of enlargement. So I'm going to have you turn a little bit. I'm going to be placing my hands on your neck, so just let me know if you feel uncomfortable. Okay, I do feel the cricoid cartilage. And with swallowing, I do feel the thyroid gland. I'm just going to displace it to the left. Any tenderness?
No.
Now to the right. Any tenderness there?
No.
All right, very good. And I don't feel any masses or nodules on either side. So next, I'm just going to feel for your carotid arteries. All right, very good. +2 on both sides. And then I'm just going to listen. All right, very good. I don't hear any bruise, so that's good. Next, I'm just gonna feel your lymph nodes. So preauricular are soft, postauricular are soft, tonsillar are soft, submental are soft, superficial cervical are soft, deep cervical chain are soft, posterior cervical are soft, and supraclavicular are soft. Any pain or tenderness in any of those areas?
No.
Okay, very good. Moving on to respiratory, I can see just that you're not having any signs of distress, no signs of trouble breathing. From what I can see, chest expansion is symmetrical. Anterior, posterior diameter looks symmetrical as well. So now I'm gonna have you just turn to this side. Thank you. All right, I'm just gonna place my hands on your back. Just take a deep breath. All right, very good. Everything looks symmetrical. Now I'm just gonna tap on your lower back. Any pain or tenderness?
No.
Okay, very good. No costovertebral angle tenderness. Now I'm just going to place my hands on your back. Every time you feel my hands, just say 99. That's testing tactile fremitus.
99, 99, 99, 99.
Perfect. I can feel the vibrations equally on both sides. I'm going to be tapping in all of your lung fields. Perfect. Any discomfort?
No.
Okay, very good. Now I'm just going to listen to all of your lung fields. Every time you feel my stethoscope on your back, just please take a deep breath. Okay, very good. I'm just going to listen to the front. All right, very good. Lung sounds are clear and equal bilaterally, anteriorly, and posteriorly. Next, we're going to do egophony. So whenever you feel my stethoscope on your back, just say the letter E.
E. E. E. E. E. E. E. E. E. E. E. E. E. E.
Perfect. No signs of consolidation. We're going to do the same thing one more time. This time we're doing bronchophony, so just say 99.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
All right, perfect. No signs of consolidation there either. I'm going to have you turn back. This time I'm just going to listen to your heart. Starting aortic, pulmonic, Erb's point, tricuspid, and mitral. All right. Listen again. Okay, very good. I hear S1 and S2 sounds. Rate and rhythm sound regular, and I don't hear any clicks or rubs, so that's good. And I don't see any signs of cyanosis or pallor either. So now I'm going to have you lay back and lift your shirt for me if you don't mind. All right, I'm just going to feel. All right, I don't feel any heaves or thrills. And at the point of maximal impulse, I do feel. And at that point, I would listen and count for 60 seconds. Next, I'm just gonna feel your pulses on each side, starting radially, +2 on each side, brachially, +2 on each side, femoral, okay, +2 on both sides, dorsalis pedis, +2 on both sides, and then posterior tibial are +2 on both sides, so very good. Moving on to your abdomen, everything looks symmetrical. I don't see any scarring or lesions. Umbilicus is midline, so I'm going to start off by listening to your bowel sounds, starting in the left upper quadrant. Left lower quadrant, right lower quadrant, and right upper quadrant. All right, very good. Bowel sounds are normal and active in all 4 quadrants. Next, I'm just going to listen to all of your arteries as well, starting with aortic, okay, renal, iliac, and femoral. Okay, very good. I don't hear any bruits, so that's good. Next, I'm just going to percuss. Any pain or tenderness?
No.
All right, now I'm just going to palpate lightly. Any pain or tenderness?
No.
All right, I'm just going to go deeper. Any pain or tenderness?
No.
Okay, good. And abdomen is soft, so that's good. Now I'm just going to feel for your liver. Any tenderness?
No.
All right, very good. And no signs of enlargement. Now your spleen. Any tenderness?
No.
All right, very good. No signs of enlargement there either. All right, you can go ahead and sit up. Now I'm just going to feel all of your joints for any tenderness and swelling. Okay, any tenderness or pain anywhere?
Nope.
All right, very good. And I didn't feel any swelling. Skin is warm, no signs of edema. Next, we're going to do some range of motion exercises. So what we're going to do is we're going to start out with your shoulders. So abduction, adduction, internal rotation, external rotation. Perfect. Elbows extend or flex extend, pronate, supinate. Wrists, inversion, eversion, flex, extend. Spread out your fingers, very good. And I'm going to have you stand up. We'll do your hips. So abduction, adduction, other side. Knees, flex, extend. Perfect. You can go ahead and sit back down. And then lift up your legs, wiggle your toes, and then dorsiflexion, plantar flexion. Very good. Any pain anywhere?
No.
With those movements? Okay, very good. Okay, next we're going to do some rapid movements. So go like this. Very good. Heel to shin. Very good. Next we're going to test some cerebellar function testing. So I'm going to have you put your finger on your nose and then touch my finger while I move it around. Perfect. Other hand. Perfect. Cerebellar function is intact. Next, we're going to do some proprioception. So I'm going to have you close your eyes and give me your hands. I'm going to be moving your fingers up and down. Tell me which way I'm moving them.
Up, down, down, up, down, up, down, down.
Perfect. Same thing with your toes. Just keep your eyes closed.
Up, down, down.
Perfect.
Up, down, down.
Perfect. Next, we're going to do something called stereognosis. So I'm going to have you keep your eyes closed and hold out your hands. I'm going to place something in your hands. Let me know which hand you feel it in.
Right, left.
All right, perfect. Next, we're going to do grapesthesia. So keep your eyes closed. I'm going to draw something in each hand. Tell me what you think I'm drawing.
3, 2.
Perfect. So those are intact. You can open your eyes now. We're going to do some sensation testing. So you'll keep your eyes closed. I'm going to touch you with a sharp side and a soft side on your arms and legs. Just let me know which side you feel.
Soft, sharp, soft, soft, sharp, sharp.
All right, now your legs.
Sharp, sharp, soft, soft, sharp, sharp.
Perfect. Sensation is intact. Next, I'm going to test your reflexes. So I want you to just try and stay relaxed, okay? Starting with your biceps. Okay, triceps. Okay, brachioradialis. All right, and now patellar. Okay, and then Achilles. All right, very good. Reflexes seem to be intact as well. Next, we're going to do some strength testing. So if you could do this, don't let me push you, pull you, out, push, pull. Perfect. Spread out your fingers. Don't let me push them together. Very good. Lift your legs. Don't let me push them, pull them, push, pull. Very good. And then dorsiflex, plantar flex. Very good. All right, strength is equal bilaterally on all sides, or on all extremities. So that's very good. Next, I'm gonna have you stand up. I want you to just stand here with your eyes closed. This is the Romberg test. And I don't see any swaying. Balance seems normal. Now I'm just gonna feel your spine. If you could bend at the waist. Okay, no signs of deformities or scoliosis. And then I'm just gonna feel cervical, thoracic, lumbar, and sacral. Any tenderness or pain?
No.
Okay, very good. I don't feel any deformities either. Now I'm just gonna have you walk normally over there. Okay, gait is steady and normal. And now I want you to walk back heel to toe. Okay, very good. Gait is steady and normal. I think that concludes our exam. Do you have any questions for me?
Nope, thank you so much.
Okay, thank you.